All right. Hello and welcome everyone to today's event where we're going to talk about the medical review findings in the reviews of Hyperbaric Oxygen Therapy, or HBO. My name is Mary Sue Gardner. I'm a registered nurse from the Provider Outreach and Education Department, and I'm joined by other members of Provider Outreach and Education, as well as Medical Review, who are going to be assisting me in the open question and answer portion of today's call. So for purposes of coverage under Medicare, HBO therapy is a modality in which the entire body is exposed to 100% oxygen under increased atmospheric pressure, and that's done in an enclosed chamber. And the chamber may be a single-person chamber or a multi-person chamber. Those multi-person chambers usually use an apparatus commonly referred to as a hood on each individual patient to deliver that prescribed medication or prescribed treatment of oxygen. So today we're going to focus on HBO therapy, and it's not necessarily for a single person or a multi-person chamber because we cover both. So we want to focus on those review findings. On your screen and in every event, we have to show you and explain to you our disclaimer. And the disclaimer basically says we prepared this education as a tool to assist you with the Medicare regulations. But the Medicare regulations often change. So it's your responsibility as a provider to make sure you are following the most current laws, rules, and regulations as they stand for that day. Everything we're telling you is effective as of today, but if the rules change tomorrow, it's your responsibility as a provider to make sure you're following tomorrow's rules. We're going to provide answers to questions based on the most current laws, rules, and regulations and facts given today. Again, but if that changes tomorrow, that could change our response. So Medicare is, the final determination of coverage as always. And finally, CMS prohibits the recording of our presentations for profit-making purposes. Since we don't know why you would be recording, we ask that you please stop and don't make any screenshots of our education. We are recording this for you though. And remember, within 15 business days, it will be posted as an encore on our YouTube page. And then finally on your screen is some acronyms. And these are common acronyms in HBO treatment. I may or may not refer to any or all of these acronyms during the course of the presentation. So if I say something and you don't know what it is, please refer back to this list. All right. My objective for today is that you learn about the most common review findings in HBO therapy reviews and how to avoid these denials. And we're going to accomplish this today by reviewing the coverage criteria for HBO. We're going to discuss documentation requirements, and we're going to analyze the review findings and give you some tips of how to avoid those actual review findings. The primary goal of HBO therapy, as noted on this slide, by exposing an entire body to 100% oxygen under increased atmospheric pressure, the primary goal of HBOT is to increase the amount of oxygen in the blood. That's done in an effort to promote healing as well as fight infection. It also stimulates the formation of collagen for new blood vessel development. And it can replace inert gases in the bloodstream with oxygen. So as we move on your slide and in your slide deck, please note that there is a national coverage determination for HBO therapy. That national coverage determination gives you all the covered conditions non-covered conditions. I've pasted a picture on your screen of what that NCD actually looks like. But the title is also hyperlinked. So I'm going to go ahead and use the hyperlink, hopefully if it'll work for me. And I am going to bring up the actual NCD. And it wasn't pulling up from my hyperlink. It was just taking a little while, but I already had it pulled up in the background, and that could be why. So if you go to cms.gov, in the Medicare coverage database, you can simply go into the search and type in HBO, and you are going to find there's the NCA articles, NCD articles for HBO. Now, these are articles that are specific to contractors, so those are Noridian articles. But what we're interested in is the hyperbaric oxygen therapy, and here's the actual NCD number. So we're pulling that one up. And I just want to pull this up to show you this is where we get our information, not only for review, but for education. So the information that we're providing you today is also the information that is contained within the NCD. So as you can see where this NCD starts out is it goes into indications and limitations for coverage. And there are a number of indications for coverage, a number of diagnoses or reasons that Medicare will pay for HBOT for these conditions. So they range from things like carbon monoxide poisoning, decompression illness, even gas embolism and gaseous gangrene, all the way down to treatment of diabetic wounds for, those patients with lower extremity wounds that meet the following conditions. And those conditions are listed. As you move on in the NCD, it also gives you the non-covered conditions. So no program payment will be made for HBO in the treatment of these following conditions. So there's cutaneous, decubitus, and stasis ulcers, peripheral vascular insufficiency, you go into cardiogenic shock and sickle cell anemia, and all the way down to things like MS or multiple sclerosis, arthritic diseases, acute cerebral edema. Although these may have been used on people in the past, there's just not enough evidence to support the efficacy of treatment for these conditions. So CMS has listed these as non-covered conditions. And then it goes on to give a little information about topical application of oxygen. And if you scroll to the bottom, you can also find links to the NCAs as well. So I do encourage you to go out to the MCD database to read everything about the HBO treatment. Now, the other thing about HBO is if you don't go to the MCD database, you can also go to the regulations and guidance. So if I go to Medicare, regulations and guidance, and I go to the manuals and the internet-only manuals, and the NCDs are all housed in 100-3. And then I would just go to the coverage or part that covers HBO therapy. And I believe, I don't know why the number just left my head, it's 20 point something. And yeah, I think it's 20 point something. So I would just find the corresponding one for that. And why the number just left my brain, I am not sure, but that's okay. 20.29, I believe. Yes, right here, 20.29. So if I click on that, it takes me to the NCD in the internet-only manuals instead of in the Medicare coverage database, and it gives me the same information. My covered indications, my non-covered indications, topical application, etc. All right, so let's go back to the slide deck. So the next 3 slides just kind of list those covered indications that we talked about that were on the NCD, or the National Coverage Determination. And so I'm not going to go over all of them, completely, but I'm just going to make note of some of them. So, we got acute carbon monoxide poisoning intoxication, and we have down here acute traumatic peripheral ischemia. So this is an emergent condition of inadequate blood oxygen supply. So HBO therapy is actually a valuable adjunctive therapy to be used in combination with other acceptable standards of therapeutic measure, especially when there's loss of function or loss of limb or life is threatened. As you move forward into other covered indications, you can see there is additional things like, we have preparation and preservation of compromised skin grafts, and that's to prepare the already compromised recipient site for a new flap or graft, not for primary management of the wounds. So as you go through and look at the NCD and compare it against this list I have for you in the slide deck, sometimes the NCD has some additional explanations. So I encourage you to go out and look at those additional explanations, especially when it comes to diabetic wounds of the lower extremities in patients. And the patients must meet the following 3 conditions. So this is a must I want to draw you to. So the patient has to have diabetes type 1 or type 2, and they have to have a lower extremity wound that's due to the diabetes. The patient has to have a wound that's also classified as the Wagner grade 3 or higher. And we're going to get into this a lot more when we talk about review findings. And then also the patient has failed an adequate course of standard wound therapy. So again, if you're doing HBO for diabetic wounds of the lower extremity, all of these must be met. So again, please refer back to that NCD, either in the IOMs, the Internet-only manuals, or in the MCD database, whichever ones, they're exactly the same. All right, so adjunct therapy. I've said kind of adjunct therapy used as an adjunct therapy, but I want to kind of give a little bit more explanation. The use of HBO therapy is considered an adjunctive therapy only after there are no measurable signs of healing for at least 30 days of treatment with standard wound therapy. And it must be used in addition to the standard wound therapy or the standard wound care. So a couple key things there. There's been no measurable signs of healing and you've been doing that conservative therapy for at least 30 days. Then you're going to continue and use HBO as an adjunct to that standard wound care as well. So standard wound care in patients with diabetic wounds includes things like assessment of the patient's vascular status in connection with any vascular problems that could affect the limbs. You want to make sure the patient has optimization of their nutritional status. So they are having a good balanced diet, they are following it, they are following diabetic diets, etc. They're doing optimization of glucose control. So they're tracking glucose. You know, they're reporting their highs and lows. If they're on a sliding scale insulin, they're reporting that and marking it down. You got to make sure that they're actually doing the things that they need to be doing to optimize good glucose control overall. If debridement is being done by any means to remove any devitalized tissue, we need to know about that. We need to know about the maintenance of, you know, keeping a clean, moist bed of granulated tissue. Appropriate moist dressings are being used. There's appropriate offloading if that's necessary, you know, to resolve any type of additional pressure. If there are any other necessary treatments to prevent or improve infections that might be happening, that should be documented as well. So those are all types of things that would be done in your standard wound care. And so we need to know that these things are and have been occurring, and there's still no measurable signs of healing for at least 30 consecutive days before you add wound care or treatment with HBO into the wound care, like for the diabetic ulcers. All right, evaluation timeframes. So wounds must be evaluated every 30 days during the administration of HBO therapy. So that is a minimum. They can be done every week, every 2 weeks, but at a minimum, they must be evaluated every 30 days during the HBO therapy. Continued treatment with HBO is not covered if measurable signs of healing have not been demonstrated within any 30-day period of time. So we're going to look from your evaluation to your evaluation, and in that review, within that 30-day time period, we're going to look for those measurable signs of healing. It is at this time I have to stress the importance of consistent documentation throughout your facility or throughout your office. Make sure everyone is measuring the same. Make sure everyone is documenting in the same manner. Make sure if there are standard words that are being used, that everyone's using that kind of wording consistently. It's when we see documentation that's all over the place that makes it really hard for us to determine, is there healing going on? Because one person may measure and grade a wound different than the next person. And that's what you want to avoid. So that really takes some internal education within your facility, within your office, et cetera. And then as we move on, the next 3 slides, again, these are the 22 non-covered conditions that are also listed in the NCD that will make a claim for HBO not payable if they're done for these following conditions. So I'm not going to read all of these to you because they're on your slide. And again, they're also in the NCD. But do be aware that when you go out and look at the NCD against the documentation or the diagnoses that are listed here, sometimes there's a little bit more information that gives you kind of an example of what they're talking about, like acute thermal and chemical pulmonary damage. For example, smoke inhalation with pulmonary insufficiency. So there's examples like that, again, in the NCD that will help you. Non-vascular causes of chronic brain syndrome, and that includes things like Pick's disease, Alzheimer's disease, or Korsakoff's disease. As you move into the final list of non-covered conditions, again, these are things that, we kind of pointed out as we looked at the NCD as well, so I'm not going to read them to you. All right, so that moves us into documentation. For both Medicare Part A and Part B treatment, the documentation requirements for HBO must be sufficient to support the need for HBO therapy for an improved condition. So on the following slides, we're going to cover some specific components of documentation, but know whether you are on the facility side providing the HBO or you are on the provider side and you need to give the facility information to support their claim, it's pretty much the same documentation that needs to be present. So let's move in and talk about this documentation as a whole. HBO treatment records and dive sheets, including ascent and descent times and pressurized level. So basically, we need your dive sheets, and your dive sheets need to have your start time and your stop time on them, as well as the pressure levels on them. And that goes on in hand with your signed physician orders for HBO. So your physician should be indicating things like pressure levels and, dive times, and giving the indications of how long they want the person under the 100% oxygen and how deep that needs to be. So those are all types of things that, kind of play into each other. But no, we have to have your treatment records and dive sheets for each date of service under review. History and physical that describes the condition for HBO. So we need to see something from the physician that outlines why this person needs HBO, and that needs to be one of those covered indications that we talked about. Other things like physician progress notes, and that's really going to be supporting all and any adjunctive therapy that's provided. So the adjunctive treatments do not necessarily have to be in the physician progress notes, but we do need to see what additional adjunctive therapy or treatments are being performed. Where the physician decides to document those type of treatments and treatment outcomes is where they decide to document them. But we have to have copies of that. We have to be able to see that, whether it's, on what they formally call a progress note, or whether it's, in other forms of documentation within your chart. Laboratory and pathology reports, if applicable. Sometimes we need to know via lab test, via radiology test, via pathology test, what kind of wound you're dealing with. So if those types of things are done, they need to be included in the documentation if requested for review, which again rolled in the radiology reports as well. Some additional documentation. If you've done any vascular studies, we need to see those. We've talked about documentation to support a minimum of 30 days of failed conservative treatment of your wound care. Again, we need to see what was done, why it was done, where, the what, when, where, why, how, etc. So we need to know that it failed, what was done, when it was started, if it's still ongoing, etc. If there's been any operations or operative reports or prior procedures that were done for this patient, which kind of brings us into the next thing if you think about those going hand in hand. So a prior procedure could be radiation treatment to a certain spot. or, you know, it could have been an operative site that didn't heal, and why didn't it heal? And does it fit into one of the categories that necessitates HBO therapy? But again, procedures could run into things like radiation treatment. They've had radiation treatment to a site, and now they have post-radiation issues with that site that now necessitate HBO. And then again, if they were receiving any antibiotics, that kind of goes back to support some of the conservative things that were done, and documentation to support direct physician supervision of HBO. So we need to see, and it is a requirement of the facility to have that physician that monitors and oversees the HBO while those dives are being done. And then finally, under documentation, some additional documentation guidance that I want to, just remind you of. Ongoing assessments of the patient's condition need to be done every 30 days. So we need to have an overall assessment every 30 days while the patient's under HBO therapy. And then if you are giving any ABNs or advanced beneficiary notice of non-coverage, if one of those is applicable, that needs to be provided as well. And I do see that a question popped in: can the nurse practitioner provide direct supervision? And I believe that answer is yes, but I am going to have to look that up and verify, and I'll have, if someone from medical review knows that answer right offhand, they can put that in the chat to everyone, if it's acceptable in your state. But I will double check on that before we, finish up with today's webinar. All right. So now that moves us into the common review findings from our medical review department. Now, our medical review department is looking at HBO services from both a Part A perspective and a Part B perspective for the physicians that order and oversee HBO therapy. So I'm going to talk, these next handful of slides go over some of the denial reason codes, that you may see or you may find are on your claims that made your claim for HBO not payable. Some of these are Part A denials. Some of them, the numbers correlate to Part B denials. However, the issue itself could be applicable to A or B, just depending on who we're looking at. So, I want you to focus more on the error meaning itself and not as much on the numbers. The numbers will make sense to those people that are in your billing and coding system and know what this means, or want to know what this means if they see a denial reason code. So HBO 2P, this is a Part A denial. So the HBO 2P error code is assessed for insufficient documentation to support soft tissue radionecrosis. So in other words, we need to see a history of radiation for cancer, when it was given, where it was given, etc., as well as labs or diagnostic tests that confirm the soft tissue radionecrosis, or STRN. That's the acronym for soft tissue radionecrosis. Again, we expect to see that there's a history of radiation therapy for cancer, and that radiation was given in the area for which HBO will be administered as well. We also know that soft tissue radionecrosis may not be present for months or years after treatment. So as reviewers, we know that that is a possibility. So your documentation and your search for that information from a provider's office may have to go back a little bit to get that information to support that's where the radiation was provided. So how do you avoid this denial? By ensuring you have and are able to submit the documentation to support HBO as adjunctive therapy for soft tissue radionecrosis, which means you should be documenting all the other conventional treatments that are or were being done, that you're supporting the history of radiation for cancer, like we just reviewed, and that history also contains information on the site that radiation was administered, as well as, again, laboratory diagnostic tests to confirm that it is indeed soft tissue radionecrosis. So lack of documentation will continue to result in denial of services. All right, so as we move on, the next denial reason code is GBB02, and this is Part B denial. So in MCS, it'd be a K, which would be a K01 is maybe what you see. It doesn't give as much explanation as a Part A reason codes. That's just the way MCS is. But the denial reason code that you may get and you may see on your claim review information from the nursing staff, the GBB02 means the documentation was incomplete or insufficient, which could mean you didn't submit everything we requested, or you didn't document everything that was necessary to document. So without those critical pieces of information, we cannot accurately support that the services were medically necessary. So really simply, you can avoid this issue by re-reviewing the documentation requirements, as well as the coverage criteria, and make sure you have everything to submit for review. As we move on, another Part A, HBO 3D denial, is because the documentation submitted did not support the diabetic wound to be a Wagner grade 3 or higher. So in other words, you didn't give us the evidence or the staging provided to support that the diabetic wound actually is graded as a grade 3 or higher, and that there's evidence that there's abscess, deep wound ulcers, or bone involvement, etc. So make sure that not only is the physician stating the grade, the Wagner grade, it has to say Wagner grade, whatever, 3, 4, 5, 3 or higher, that information is in the documentation, as well as how it looks. So if it's a grade 3, is there presence of osteomyelitis, cellulitis, deeper tissue, etc.? I mean, is there bone involvement? Is there deep ulcers, etc.? So avoid this issue by documenting A, that there's a foot ulcer, that foot ulcer is what kind of condition, is it diabetes, and if that is that type 1 or 2, that there is indeed an ulcer, where the location is it left side, is it right side, is it heel, is it foot or midfoot or other part of the foot? So again, foot ulcer, diabetic, what type of diabetes, where on the foot, which side, which foot, the depth, does it have necrosis, does it don't have necrosis, is there muscle involvement, is there necrosis of the bone, is there any bone involvement without, evidence of necrosis? So these are all types of things to consider. as well as the type of infection. If you sent to laboratory and we have typing of infection, is it a cellulitis? Is it an abscess? Is it osteomyelitis? And then again, you have to say Wagner and you have to give the grading. It has to be grade 3 or higher. So just giving the description is not going to cut it. We need to see Wagner grade 3 as well as the indications that make that a grade 3. The next most common issue in HBO, and again, this is part A, so you can see the ones that are part A start with HBO. HBO 2L, insufficient documentation of chronic refractory osteomyelitis. So in the chronic refractory osteomyelitis, got a mouthful there, CROM, that's the acronym for that. So that's a bone infection that has not responded to conventional therapy such as antimicrobials or surgical debridement after a 6-week course of therapy. So patients who are immune suppressed or have other comorbidities like diabetes are more likely to develop CROM. The most common presentation for CROM is long bones after trauma and in diabetic foot ulcers. So in DRU, about 20% of patients that are referred to a wound center will have osteomyelitis. So let's think about what I just said in this explanation. We need documentation to support the conventional therapy, such as the antimicrobials, surgical debridement, et cetera, that they've been tried, that they failed for at least 6 weeks. This, again, is a pretty easy one to avoid. Just make sure you have the info in the chart as to what those conservative therapies are that were tried and failed, and the length of time they were tried and failed. And finally, make sure you're submitting all lab reports to support the diagnosis of CROM. As we move on, HBO2I, under this denial reason, there's insufficient documentation to support progressive necrotizing infection. So for instance, patient symptomology like intense pain and tenderness over that subcutaneous tissue, that it's demonstrating like a woodening or hardening feel. Usually the most important signs are the tissue necrosis, the putrid discharge, severe pain, gas production, there's rapid burrowing through the fascial planes, you know, and a lack of tissue, classic tissue inflammation signs. It doesn't look like classic tissue inflammation. It's more than that. Also, supporting the diagnosis could also mean supplying imaging that has been done, like x-rays or CT scans, or even laboratory documentation like cultures. Sometimes in a necrotizing fasciitis case, you are often starting the treatment before you have time for the cultures to get back. But you have to rely then on things like your x-ray CT scans that you can get immediately, and the physical exam of the site, the wound, what's going on with it, you know, what you see, what you smell, what you feel, etc. To avoid this issue, again, is as simple as supplying all the documentation necessary to support this diagnosis. Again, that's anything from, you know, laboratory information to radiology information, but most importantly, patient symptomology and clinical exam findings. So that takes us to the end of the formal presentation. And this slide, as well as in your slide deck, give you some resources. I'll link you right out to the MCD database to get to HBO. And then here's an article with some resources that we have on our website regarding HBO therapy. So just kind of to recap, a lot of information today. But today, hopefully, you learned about the most common findings in HBO therapy reviews, how to avoid those denials. And we actually accomplished this today by going over that coverage criteria for HBO, showing you where you can find it, as well as discussing those documentation requirements, and finally finishing up with some analysis of those most common review findings or errors and how you can further avoid those. And at this time, I don't see any additional questions have come in, but I am going to ask those that, my panelists that are on the call from TOE or MR, if we were able to get any information on if we allow the nurse practitioners to provide direct supervision. Did we find it, were able to get any of that information?
Hi, Mary Sue. The only thing I could find right now with a quick search, and we'd probably have to look a little more, is looking at the CPT code 99183. And that code does say it needs to have physician attendance and supervision for the hyperbaric oxygen therapy. And so that would restrict physician assistant and nurse practitioner performing the service. But I'd like to go look a little bit deeper into the research before we finalize that answer.
Perfect. Thank you for your help with that, Jennifer and Cheryl, and all participants. We will, again, dig deep into that, and we will send that out after and make sure we are answering that appropriately. Okay, and I'm not seeing any additional questions have come to the chat. So in the interest of time, I'm going to move on. And we are going to then talk real briefly about a national provider enrollment conference that's actually being held next week. So you still have time, if you have time, to get to San Diego, California, by next week. And if you want to go to a free conference on all things provider enrollment, that's your opportunity to meet with CMS and Max, for free in an all-day event. And the description and registration, you can use the link in your slide deck, or else you can go straight to the registration from our live event page. I do see another question has come in the interest of time. I am going to, Crystal sent a question. I am going to respond to her directly. If I think it's something that warrants going out to everyone, I will send that out to everyone. But Crystal, know that I will send you an answer after this event, since we are at call end time. So on behalf of Jennifer and myself and all of Medical Review, I want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.